Welcome, everyone. We welcome you all to an interactive panel discussion on the fellowship application process. I am Sarah Ramaya, Curriculum Design Strategist and Webinar Coordinator at ASRM. Our moderators for today's session are Drs. Ronnie Fritz and Carol Wheeler. Dr. Fritz is a member of the ASRM Education Committee. He is an REI specialist in New York and an assistant professor with NYU Long Island School of Medicine. Dr. Wheeler is the chair of the ASRM Education Committee. She is a reproductive endocrinologist and professor at the Albert Medical School of Brown University. She is associate medical director of the Women's and Infants IVF program, director of pediatric and adolescent gynecology, and of course, our chair of the Education Committee. Before we begin, please note this webinar was developed by the American Society for Reproductive Medicine as an educational resource and service to its members and other reproductive professionals. While this webinar reflects the views of the panelists, it is not intended to be the only approved standard of practice or to dictate an exclusive course of treatment. Members should always use their best judgment in determining a course of action and be guided by the needs of the individual patient, available resources, and institutional or clinical practice limitations. All attendees, please note that you are on mute, except the panelists. This is a discussion and not a presentation, so please type a question in the question and answer window at any time. We will read as many selected questions as possible to the panelists, and a recording of this webinar will be archived on the ASRM website in the coming weeks, so please watch your email for notifications. I will now turn the discussion over to Dr. Fritz.
Thank you for the introduction, Sarah. Welcome, everyone. I want to welcome all the future REIs, future REI applicants, and our panelists. We're fortunate today to have 4 REI fellowship directors and 3 REI current fellows, all of different years during their fellowship process. I recall applying for fellowship in 2014. 8 years ago, but it feels like yesterday. And I remember it was a very, very exciting time in my career, as it is for most people applying, but also an extremely anxiety-producing one. There's a lot of questions that go along with this process that I wish I had answered prior. So this really is a unique and great opportunity to ask those questions and demystify the process of the REI application and interview process for our panelists, both our fellows and our fellowship directors. We're going to introduce the panelists are going to introduce themselves. After that, we're going to have a 1-question survey that should take a couple of seconds. If anybody has a question, as Sarah stated, try to remember to type them into your question and answer as opposed to the chat. If you're thinking about this question, chances are everybody else is or other people are as well. We'll go through the questions and direct them to the panelists. So we'll start with you, Dr. Sue, if you can please introduce yourself.
Sure. Thank you for having me. My name is Irene Sue. I am a reproductive endocrinologist and the fellowship director at UC San Diego. What else should I say? So I grew up in Taiwan, partly, and then I went to medical school in New York and did my residency and fellowship at the University of Pennsylvania. And I came to UCSD as a faculty member 11 years ago. I'm now the fellowship director for the past couple of years, and this is such an exciting time to be training in women's health in REI, so welcome.
Thank you. Dr. Penzias.
I'm Alan Penzias. I'm the fellowship director at Beth Israel Deaconess Medical Center in Boston, Harvard Medical School, and Boston IVF. I'm also the chair of the practice committee and a member of the board of directors of ASRM. And it seems like just a moment ago was sitting in your shoes, getting ready to apply to my fellowship in what now seems like just a whole career ago. It's very exciting to be in women's health now. There's so much exciting things going on that we bring our fellows and get them involved in. And we're looking forward to answering your questions tonight, and I'm pleased to be here.
Thank you, Dr. Penzias. Dr. Groh.
Hi, I'm Dan Groh, and I'm currently the fellowship director at the University of Connecticut. I've been there for about 4 years now and have had a wonderful time. Because we have a kind of a vibrant group of 7 faculty, and we love what we do. Previously, I was chair of the Department of OBGYN at Bay State Health, part of the UMass medical school system. And we're excited to field your questions and help transition you into the world of reproductive medicine. Thanks for being here.
Dr. Hill.
Good evening, Ronnie, and everyone else. It's great to see everyone on this panel. I wish we were all together. Such a great group of people. I am the current fellowship director at the Combined Federal Fellowship of REI. That's made up of the National Institutes of Health, Walter Reed National Military Medical Center, and Shady Grove Fertility. We take about half military and half civilian fellows, so a combination of both in our program. And I'm the current president of SREI, which has had a lot of discussion over the last couple of years as far as the application and interview process that I'm sure we will get to tonight. So it's great to see everyone.
Thank you, Micah. Megan.
Hi, I'm Megan Ocean. I'm the 3rd-year fellow at Brown University. And it doesn't seem that long ago that I was actually sitting in front of Dr. Hill telling him I will be an REI fellow. I don't care what it takes. And I don't regret my decision any way, shape, or form. I was telling one of the students that I mentor recently that I really feel like we're in just the best field because of how much things continue to move forward and how exciting the science is, and then how great the people are. Within the 3rd-year fellows, I think our WhatsApp chat goes off at least once a day, just discussing all the different challenges people go through. So it's a great field to go into, and I hope you get the opportunity to ask all the questions you have.
Couldn't agree with you more, Megan. And to piggyback on that comment, I applied in 2014. We still have a group chat of all our applicants. And still to this day, we continue to contribute to that group chat, ask REI related questions. So it's really like a nice friendship that we've made throughout this application process. And you'll remain friends and colleagues for a very long time. Pietro.
Hey, everyone. I'm Pietro Bortoletto. I'm the 3rd-year fellow at Weill Cornell in New York City. And let me just say, I'm so impressed that we managed to get 68 residents on a Monday evening all together on a Zoom. So we don't take that responsibility lightly. We're thrilled that you guys are all here with us tonight, and hopefully just provide some useful information to help make sure that your application is ready, make sure your application is strong. Because I'm going to tell you, us 3rd-year fellows are really excited to interview all of you next year as faculty. And I know the fellowship directors can't wait to see your applications. So thanks for being here.
Thank you, Pietro. And Quentin.
Hi, everyone. Thanks so much for having me. It's an honor to sit on this webinar. And I'm the 3rd-year fellow at Emory University in Atlanta, Georgia. And, while listening to everyone talk, I'm reminiscing on sitting in y'all's shoes. And truly, I really had wished that there was a platform that was similar to this when I was applying to fellowship. So I really hope that all the residents that are listening tonight takes this opportunity to field all the questions or the uncertainties that are lingering, because I think there's a lot that you can learn from the panel that's present tonight.
Thank you. So now, Sarah, maybe we want to we'll put out that 1 question survey, and then we'll get going with the questions and answers. Okay, so looks like 55% are PGY3s, which I guess means we'll be applying this go. 18% PGY2, 6% PGY1s, 6% PGY4, and 15% other. Great. Okay, Dr. Hill, perhaps we can start with you. There was a question that put up, will the interviews be virtual again? Maybe we can start with the timing of the interviews, the application process, kind of an overview as a whole, and where we're going with the virtual versus in person.
Yeah, thank you, Megan. I saw that question in the chat, and that's a perfect place to start off with. 2 years ago, SREI decided to start coordinating the application dates amongst all the fellowship programs so that it would be the same across the board. And also everyone applying via ERAS, which I think has made the process a lot simpler and more clear for people applying now than it was for some of us who applied many years ago. We don't have the final dates yet for the 2022 cycle, so I'll just sort of talk in general about what will likely be approved and posted in the next couple of weeks. The start of May will be when the applications are due. Last year, that was May 3rd, which is a Monday. So I'm guessing we'll probably shoot for that first Monday in May again this year. And then we wanted a single notification date for all of the fellowship programs to send out the notification to the applicants that they would be interviewed. And so that was the first Friday of June. So about a month for those programs to review those. So the specific date might change, but it'll roughly be the same. We also wanted for everybody to have a shared amount of time to be able to reply to that. You hear stories of people being scrubbed into OR cases, and by the time they got out of the case, not being able to answer a request, and they reply to the program and all the slots are full. So we don't want that. So we're asking that every program give the applicants 4 days to be able to respond. And then 4 days after that, the programs will send out the final notification of where and when those fellows or those residents will be able to interview. So to summarize roughly, we're talking about the start of May for your application and the start of June for being able to finalize when your fellowship interview dates are. Those dates will be posted on the SREI site as soon as we have our next board meeting. So sometime early in February, we'll post those dates. That'll be at srei.org, and just click on the For Learners. And Sarah, I'll try to put the link in the chat so that that can be shared with everyone. It's not updated yet, but it will be within the next few weeks.
Thank you, Dr. Hill. There's a question that came up. What is the most important part of the application? What is focused on the most? Perhaps we'll spin it. What's the most important thing or aspect of an applicant that the fellowship directors look for when reviewing applications and deciding to grant interviews? Dr. Groh?
We at UConn look for a well-balanced candidate, and REI is so important. You have to know some science. You have to bond with people. You have to relate with your patients. You have to have an attention to detail. So I'm going to tell you how we decide on our applicants. We divide the application into 6 parts. One is your personal statement. One is your research experience. One is your education. One is your board scores. One is your dean's letter. And one is your letters of reference. I think that's 6. I might have missed one, but we divide them, and every faculty member reads all 70 applicants' portions. So I may read 70 letters of reference. And we sort of rank them on a scale, and we do that for each segment, and we put the scores together and we invite the candidates. So, we look for a balanced application. And the thing I missed was past work or volunteer experience was maybe number 6. So we look for a balanced application. It may be that we all have different rubrics on how we decide the best, applicants, but we look for a well-rounded candidate.
Thank you. I think this is such an important question that perhaps we'll give all the fellowship directors time to answer as well. Dr. Penzis, anything else that you'd like to add and for what you look for in applicants?
Yeah, thank you. No, it is a good question, because we really do take seriously, as Dr. Groh does, we want to make sure that everybody who's putting the time into applying to us, and we're really honored that you'd consider training with us, we want to make sure that we read through all of the credentials that you supply. So we do spend some time doing that. And what we're looking for is we do it probably, I would characterize best as a holistic review, and to differentiate from some of the things that Dan said, because in addition to, just another way we look at it is, what kind of opportunities have you had as a candidate, and how have you taken advantage of them? So we know, for example, if somebody is at a program that has 3 months of research rotation and they have 15 different laboratory and clinical opportunities available, and that individual really works hard and comes up with multiple projects, great, because they've been in a very rich environment full of resources, and they've taken advantage of the opportunities afforded them. But not everybody comes from a program that has such a, kind of a hypothetical setup like that. And there are places that we've seen where there's not an REI that's a member of the department, and they do their REI rotation elsewhere. And sometimes people feel that that puts them at a significant disadvantage. But if somebody is training in a program like that, that's not, your fault. But if you have then done something extraordinary, like you've gone to the local REI 20 miles away and crafted a rotation for yourself and done a retrospective chart review, that really shows your commitment to the field and your interests. So we're looking for what resources were available to you in your residency and what you took advantage of and how you made the most of it. And to us, we find that that's a very good determinant of how you will be when you're in a different environment where there are more resources. So that's one of the ways that we look at the applications.
Thank you, Dr. Penzis. Dr. Sue.
I think what Dr. Groh and Dr. Penzias have shared, it really resonated with me. I just wanted to add 2 points. One is when we review, again, it's multiple faculty who look at your application. I look at every single application because I know the time it took for you to, and the heart it took for you to put it together. But the added sort of piece is that I'm looking for fit. So for example, we want to make sure that clinically you're sound and robust and that you can join us and gain those skills. I happen to think that UC San Diego has really truly bench to bedside, some pretty cool things happening in our School of Public Health, things like that. And I want to know why you might want to come over or how you can take advantage of the program that we would have here. And then on the other side of it is, more than ever, we want to know the distance you traveled. So I think that reflects what Dr. Penzias has said. People grow up in different contexts, but what's the distance that you traveled to get here?
Thank you. Dr. Hill, anything else to add?
Yeah, I think I would just echo what has been said by all three others. At our program specifically, obviously it's the NIH, so we want people who are interested in research. But not everybody's going to go into academics, and very few people will go into a pure research field or career. So we're looking for people that are interested in being leaders and driving the field forward in whatever way that is, whether it's through clinical medicine, ASRM involvement. Identifying that is sometimes hard, but I just want to echo what Alan said. We look at what the opportunities are that people have had and how have they taken advantage of that. And a lot of times, some of our most productive fellows have been DOs from community programs and people from very small places that did not have good REI training, but they were hungry. And you could see that in their track record. And when they come to a place like a fellowship, like all of us have, they blossom. And so that's what we try to identify during that interview process.
Thank you. On that research topic, somebody wrote in a question: I have ongoing research in REI, but will not have a publication presentation prior to submitting my application. Can this be detrimental?
I'll take that one. Oh, go ahead, Dr.
No, Pietro. No, Pietro, you go.
I was just going to say the application is actually really nice in that it allows you to put work in progress, work that's not yet submitted, work that's submitted but not accepted, work that's in press. You can really get kind of creative with making sure that you tell them that you're working on stuff despite it not being submitted or accepted yet. So really take advantage of that. If you've started projects or in kind of the early stages of drafting manuscripts, you have the opportunity to describe that in the ERAS.
Thank you, Pietro. Another question that came up, what are program directors, what are programs looking for in a personal statement, and is there a way to make it stand out? Dr. Groh?
Yeah, that's a good question. We want to get to know who you are. We know that many of you bring so many wonderful things to the table. And we want to learn about what makes you tick, and so we can understand you. Part of this is, it's almost like a dating process where we want to find a match. We want to, as Irene said, we want to find, that your personality and our programs match. So just those little clues to who you are and what drives you are important. And I can't make that up, but we're all unique, and I've been brought to tears many times reading these personal statements. I have to tell you, some of them are very touching.
Thank you, Dr. Groh. There was a question that came up. Maybe this will be geared towards the fellows. What are some questions you wish that you had asked during the interview, or wish that applicants would ask to help differentiate the programs from each other and find the best fit? So Megan, what were you looking for in programs, and how did you, what helped you differentiate one program from the other?
So for me, I really went into fellowship knowing that I had not had a lot of opportunities during my residency to do research. And I really was hungry and wanted the opportunity to take my research in multiple directions. And so sometimes figuring out how to ask that when you don't necessarily know what support structure that needs can be a very interesting question. So I think that's not just asking, what research has your fellows, your faculty been involved in, but what are other opportunities? And I think that's a really interesting way to find out what makes that program excited and tick and everything else. And then I think the other area that can be very different program to program is surgical opportunities. I think those are two areas that can be just very different program to program. And some people really want to be able to continue to hone those surgical skills. And some people really want to focus more on that art of infertility only. So I think that's two areas that I definitely asked a lot of questions about.
Thank you. Somebody posted a question about CREOC scores. How are CREOC scores interpreted? They've heard mixed things about them. Is there a threshold? Are they important? Dr. Penzis?
Yeah, I don't really love the CREOC scores because I think that's just one dimension of somebody's ability to sit for a test. I would rather, so we don't really weight that quite as highly as as you might think. I don't know, what your impression is, but I'd rather really understand what the candidate is about. I'd really understand what people have said about you, how you've performed in clinic, what your letters of recommendation are. Do people speak glowingly of you as being the go-to person, the team player, somebody who's willing to, not self-sacrifice. There's limited value to certain elements. You don't have to be completely selfless because you also have to be an advocate for yourself. But are you interested in furthering your own career and helping others around you? Do you demonstrate that leadership? And it's very interesting to read applications and see that somebody will write about the applicant that they're the person that the residents go to, or that they're the medical students kind of fly to because that person takes a real interest, of their own time to teach. So to me, those are much better important predictive qualities of somebody who's going to be a successful candidate and a great REI and a great physician than merely a CREOC score.
Thank you. One person, there was a question that came up actually more than once. In the event that one doesn't match, when they reapply, what advice do you have for them to increase their application to make it more attractive the second time around? And is it a negative that they, the second time around, is it a negative when they apply that they didn't match the first time? It depends if I can ask, if we can direct that question to you as well.
Yeah, that's a really good question. And I think that, there are a couple of different reasons why somebody might not match. One is it's just an extraordinarily good talent pool, and there's just a limited number of slots. So unfortunately, that will sometimes happen. But there are times, and I've counseled residents as they're getting ready to apply that they have a fixed geography that they'd like to be in. And, I'll use Boston as an example. There are 3 programs in town and Brown, which is just down the road. So essentially 4 in our region, and expanding it down to Yukon, because we all have a joint journal club, by the way, the 5 programs. So, you look at the 5 programs in our area, and if somebody says, well, I think that I'm probably will just end up at one of those, and you limit yourself to that geographically, I could see that be a reason for not matching. So, expanding your horizons to a wider geographic net, might be advantageous. But when I see an application, if I've seen that application before, I also want to know, well, what did that person do differently over the time since they've last applied? And sometimes it's a back-to-back year where somebody's really just reapplied, and I'm not sure that there's been much change overall in their application. And other times there's another year gap. And if they've done something substantial in that interim, then it's not a negative, because clearly for whatever reason they didn't, it just didn't sort out. But if they've continued to demonstrate their grit and determination to be in this field by going out and doing some things that are focused to improve their application and really demonstrate that this is really where their passion is, then I don't look at it negatively.
Great, thank you. There was a question that came up. How does the timing of the application matter? How early should one apply? Dr. Wheeler, I saw typing that you'd like to answer it live.
Sure. I think most programs review all applications. So setting in an early isn't going to be a big advantage for you. I think you don't want to do it at the last minute, because then you're potentially going to make mistakes and have a messy and incomplete application. Just make sure it's in before the deadline. That's really the critical thing.
There was a question that came in. What is a helpful way to determine which program offers more surgical or research opportunities than other? Perhaps we can direct this to one of the fellows. Quentin, what kind of questions did you answer? How did you evaluate whether the program was a fit for you in terms of the opportunities for surgery and also research?
Sure, great question. I think, thinking back to when I was interviewing, I made a mental checklist at each program of things that I was interested in pursuing specific to that program before I sat in front of an interviewer. I wanted to look up their start statistics. I wanted to see how many cycles they were doing. And there's actually a lot of information you can gather from this program's website. But with regard to surgical and research opportunities, I was the applicant that took a lot of time nights before the interviews that went on PubMed and actually looked at the recent publications for all of the people, all of the faculty that I was interviewing with. And you really can get a general assessment of, is this a faculty that's still quite productive and producing robust research, or is this someone that research is not necessarily their strong point? With regard to surgical experience, these are the questions that you really should be teasing out during your interview day. So not only what type of surgical procedures do the fellows have access to, but are there opportunities for fellows to scrub with the MIGS department? Is there a collaboration where if you're a REI patient that you're taking care of in your REI clinic, if they're sent to the MIGS surgeons, is that something that the fellows will have access to? So these are the things that I was looking for, because I think that collaboration is really important, especially reflecting on my 3 years in fellowship.
That's great information. And piggybacking on that, I recall we used to speak with the fellows during the interviews rather, and a lot of information obviously you tease out from the current fellows. Perhaps Pietro, can you describe how it's different now in the virtual platform, and what kind of meet and greets that are normally done during the interview process with the current fellows and the applicants?
One of the things I lament about virtual interviews, despite it being so much more affordable and easier to participate in interviews, you really do miss out, I think, on that social interaction the night before. I'll tell you what Cornell does. We do an hour with the 6 fellows the night before. There's no faculty at our pre-interview get together, and it's just an hour. It's usually some kind of icebreaker where we get to know you a little bit, you get to know us, and periodically we're sharing some fun facts about the program and people can ask us stuff. I think those sessions, now that you have the ability to attend them a little easier, you don't have to make that flight at night, you don't have to get coverage for the night before, I think are important. So I would definitely try to make your best effort to do that. And I know that's not always possible, but it varies program to program. A lot of them don't have them at all in the Zoom era. A lot of them have some kind of an hour, and some of them have something a little bit more formalized where faculty actually go and meet with folks as well. But I think any effort you can make to attend those is probably important. And be on your best behavior. I think everyone knows that, but every time you're in front of faculty or fellows, you may not be being assessed in a formal way, but people are forming an opinion about you. So have your camera on, make sure you're participating as best you can.
That's great advice. Thank you, Pietro. There's a question that came up. How important is presenting at ASRM? We'll kind of broaden this and say, how important is your research? What should you know about your research? Is it important is it a big deal if you did research that wasn't REI related? Dr. Sue, perhaps you can tackle that question.
Yeah, to me, it's not, or to our program, it's not important at all. It's the process that you've been through. So I'm not sure that I care whether it's 15 abstracts or 1 abstract if you can tell me why you did what you did. And we know that it takes time to undertake rigorous research. So if you have 15 abstracts, I do think that we're looking for conversion. If you had that much time to be involved, then did you convert to manuscripts? And whether it's an REI or a Eurogyne or general OBGYN, it's really sort of the approach and the scientific method and the curiosity.
Yeah.
Not have to be REI specific.
Thank you. Dr. Hill, do you know if all the programs listed on the SREI website will be participating in the match?
We do not know that yet. We have, since COVID, had more programs take internal candidates than otherwise, and that might be than they did in years past, and that might be because some programs didn't feel as comfortable with the virtual platform. I do not yet have a good feel for what % of the programs will be matching internally and what % will be going through the ERAS match or the NRMP match.
Do we know the total number of programs? Have there been any more that have been accepted in the past year or two?
We're still hovering right around 50. There have not been any more accepted in the last 2 years. There have been 3 that have closed for a variety of reasons.
Let's gear a couple of questions for the current fellows. Megan, what were you looking for in programs? What stood out for you? And how did you tweak that out during the interview?
Sure. So I would agree with Quentin. I think doing your homework is really important. So, I mentioned briefly that what I wanted to do for research was something that was important to me. So when I had the opportunity to speak with people, I had already reviewed, as Quentin mentioned, their previous research, et cetera. They're giving their time to interview you. There's no other time where you get multiple experts in the field giving you 20 to 30 minutes time dedicated one-on-one. So picking their brain, figuring out what they felt were opportunities and really things that they felt their institution shined at. Everybody likes to talk about things they do well, and a little bit the things that are frustrating. So finding out where IRBs were really a challenge, et cetera. So I think that was something that really offered a great opportunity. And then, as I mentioned, kind of the surgical numbers, and hopefully that's something that we're going to continue to push to have more transparent on websites and everything, so that as you're choosing which programs you really want to gear that application to and prioritizing those interview dates, that you have that information in front of you to craft where your career might go.
Thank you. Post-interview follow-up. I remember this was an area that nobody could agree with. Do you make a phone call to the program director? Do you not make a phone call? If you do you only make them to one, your top choice, or do you make them to your top 3 choices? Are people going to talk and say, oh, they told me this one, he told me that one? Dr. Groh, maybe I can direct that one to you. What are your thoughts on post-interview follow-up?
Yeah, I'm going to go out and say that I think it's relatively important, actually. I think it can be as simple as an email that's, that says that we appreciated the visit, and perhaps, ideally a little thoughtful insight into the day, or to let the program know that you're sincerely interested. I know it matters to us when we sit down on rank day as a group and go through. We pay attention to whether or not a candidate has responded and has expressed any interest in the program. We don't participate in saying, we're going to rank you first and that kind of game, but showing some sincere interest. And we as a program often send emails to candidates too that we enjoyed interviewing.
And Dr. Penzis, what's your thoughts on that?
Yeah, we tell candidates during the process that, we would love if they feel inclined to hear, to reach out to us. We'd be happy to hear from them, to just be prepared to get back, a fairly bland, thank you so much. We really enjoyed meeting you, something sincere from us, but it's not going to really kind of hint at anything because we want to play by the rules. And, as Dan said, it's always nice to know kind of where you stand with the candidates, because I don't think that somebody who might rank, 10th on your list will all of a sudden be pushed to number one because they express tremendous interest. On the other hand, if there are two candidates who, and everybody these are, and when I say 10, I'm talking about these are people who are millimeters apart. So we're really, you guys are the cream of the crop when you're being interviewed. So, at that point, it sounds a little bit more harsh maybe than I mean it to be, but if there are two candidates who are we're just so split that it's like flip of a coin which one, and one says, hey, I really enjoyed it and I really feel that this is a good fit for me and I'd love to be in your program. You don't have to say that I'm going to rank you number one. You don't have to go to that extent, but just expressing that sincere interest might cause us to flip if somebody else has not reached out. Again, it might shift things a little bit.
Thank you. There's a question that came in. Certain programs allow fellows to do joint fellowship programs, such as in genetics. Dr. Hill, perhaps I'll allow that to you. Do you know of any programs that allow genetics? I believe does that NIH have one?
The NIH does, Johns Hopkins does. There may be one other that has a joint as well. Yeah, ABOG actually has that list on the ABOG site as far as which have the combined genetics REI fellowships. There is some ability to do joint AAGL REI fellowships where you can get AAGL certification as well as REI within the 3 years. I'm not aware of any other combined training programs. Is anyone else? Am I missing anything?
There are programs that allow you to get a second degree during REI fellowship, both ones that advertise and ones that don't. I, for example, felt strongly that I wanted to get some advanced clinical trials and statistics training in fellowship, and Cornell didn't offer that. But having spent time on their website and getting some of the emails that went out through the medical school, I saw that there was this really great Master's of Science in Translational and Clinical Investigation that you could do in 2 years during your last 2 research years here at Cornell, and asked my program if I could do it. And they were supportive, and I'm going to be completing it at the same time that I complete fellowship. So just because the program doesn't advertise it in places like Penn or Northwestern are kind of the traditional ones that you think of advertising a dual degree, peruse the website. You can ask about it on interview day. I see that X school also offers a master's that's part-time. Have you had fellows that have done this before? And would you consider allowing fellows to do this during fellowship if it's important to you?
There's a question that came up. Do any programs have the opportunities to moonlight in obstetrics to keep up our skills? I remember when I was applying, there were some applicants that really wanted to moonlight for multiple reasons in OBGYN, and some programs even mandated coverage, perhaps on labor and delivery, and some of the fellows were opposed to that. Dr. Sue, perhaps we can go through all the program directors. Dr. Sue, does your program mandate coverage or allow coverage?
We allow coverage within ACGME guidelines for your work hours, but we do not mandate coverage for general OBGYN.
Okay. Dr. Grow?
We allow moonlighting. A year or two ago, our department chair asked whether or not the fellows would do department call, OB call, against, mandatory, if you will. And so our fellows surveyed all the other fellows, and apparently there's only 2 programs in the country that mandate OB call. So it's not very common.
Okay. Dr. Penzis?
Yeah, our fellows are allowed to moonlight. The moonlighting opportunities that they generally choose are coverage, sort of extra night coverage of the practice, and they do some moonlighting with regard to covering resident clinics. But we haven't had any fellow express any interest in covering labor and delivery. I guess we would permit it within the ACGME guidelines, but we wouldn't encourage it either. Let's put it that way.
Dr. Hill?
It is not required. It is allowed unless you are active duty military. So if you were Megan in my program, you would have the honor of serving your country by taking L&D call once a quarter. But otherwise, we don't require it.
This is a
Instead,
great.
I'm at Brown and I don't have to deliver any babies.
This is a great, Megan. This is a great open-ended question for the fellows. Is there anything that you wish you knew about the fellowship process before, or the fellowship before you started?
So I think as residents, you have relatively little exposure to REI, even when you do get the opportunity to rotate through. So I think I wish I had taken opportunities to go through some of the online courses that are available. I think I'm finishing up my ASRM embryology certificate. And the amount of information that's on there that I'm like, wow, if I'd known this as, an incoming first year fellow, I think I could have designed more research studies and things like that. So I think the amount of information and content that's out there to really broaden your knowledge when you walk in the door is really phenomenal. And I think it makes you stand out both as an interview candidate, as well as once you hopefully have a successful application and match when you're starting. I think taking advantage of that.
Thanks. Quentin, anything you wish you knew prior to applying for the fellowship?
Sure. It's a great question, Elizabeth. I can recall just, collaborating with my class when we all got accepted at SREI in particular. I remember there was a tremendous amount of anxiety about the level of skills and knowledge when it came to anything related to reproductive medicine. And I would argue that most residents start fellowship with a very limited to almost no understanding of how to manage an IVF cycle. So I think that's a normal feeling, and I'm trying to normalize this, but I think most fellowship programs, I would argue, expect that for their incoming fellows. There's a reason the fellowship is 3 years long. So it's a totally normal and expected situation to be in, that you're entering with just not a great background. But I will say, reflecting on fellowship, I think I definitely applaud everyone that's here tonight for taking the opportunity to really ask these questions and really educate themselves, because I think that you're in a unique opportunity or a unique position to really put your best foot forward. And I think, reflecting on my experience, asking questions about, similar to what Pietro was commenting about, other opportunities for rounding out your fellowship experience with genetics information. Genetics is such a huge part of our field in clinical medicine. So these are things that we should be thinking about. For me, how does statistics education play a role in my fellowship experience? That's something that wasn't on my radar when I was interviewing for fellowship programs. And I think statistics, like a formal education and how to evaluate a publication from a statistical standpoint, is really key. And just kind of my last point is, I think another thing going into fellowship, at least when I was in y'all's shoes and applying, thinking about your long-term career interests and how can these programs really support you in achieving your long-term goals. For something that was really important to me was aligning myself with mentors that could help me on my long-term goal of really catering to LGBTQ populations. So I'm really grateful that I found a program that has mentors that could really set me up with different networking opportunities or connections around the country. So, obviously thinking about surgical numbers and IVF numbers, these are all important things, but it's also the things that we don't always think about that I think are crucial at this stage in your career.
Thank you. There was another research-related question that came up. Dr. Hill, somebody asked, is basic science research valued more than clinical research? Do you differentiate the two? What do you look for when you look at somebody's research, their research component of their CV?
No, when we're looking at applicants, I don't think that matters at all to us, even though we're a pretty bench-heavy research program as far as our opportunities. As Irene said, we're looking more, do you understand the principles? Were you involved in the project? Do you understand what you did, why you did it? That's much more important to us than the type of project. And I think for in-fellowship training as well, ABOG has become much more relaxed on what type of research can qualify and pass for the thesis. So we have about a 50-50 split between clinical and bench research now in our actual fellowship training.
Thank you. Pietro, any major differences for the fellows that are applying that are between applying for a residency and a fellowship program? Should you be looking for different things? How do those two application processes differ?
I think the biggest difference in coming from med school and into residency and then going from residency into fellowship is the ability to kind of tell a story becomes a little bit more important in fellowship. Applications have a general sense of what kind of themes you want to spend time in fellowship learning about, what kind of mentors you think would help you learn about those themes, what kind of research you're interested in doing, because I think that speaks a little bit to the goodness of fit for programs. For me, my story was, I want to do reproductive surgery, I want to do research. And for me, Cornell was that fit because they did reproductive surgery and saw a lot of patients and were able to do research. Whereas if I told that story at a smaller program that had no REI surgeon doing a lot of procedures and saw a very small patient volume, it'd be a much tougher sell. So I think the story really becomes important. And you tell the story through your application. Not everything needs to go in your ERAS. I think that's a common mistake people make. You can pick and choose what you want to highlight as an important experience, what you want to highlight as an important research project, who writes your letter and what you ask them to speak about in your letter. I think this is all kind of the art of crafting the story beyond just what you tell them on interview day and what you're looking for when you come up with your application list.
Thank you. Somebody asked a question, how many interviews do programs typically offer? And has that changed? Also, a spin on that, well, has that changed now with the virtual platform that most people that are doing virtual? Dr. Penzias?
We have 24 interview slots, and it's so hard because there would be 50 candidates that immediately look, oh, we'd love to talk to them, and probably 70 people who would be qualified, to do a great job in the fellowship. But we feel that to be fair to the candidates, we interview 24. We have, as I said, 24 slots available, and that gives us an opportunity to really spend enough time with the candidates on the interview day slots to be able to really feel like we get to know them, and hopefully, equally importantly, that you get to know us, because the goodness of fit is not just one way. It's really bi-directional. Does the place, it may have great reputation. It may look great on paper. It may be great for somebody else, but if it doesn't feel like it resonates with you, you're going to be able to assess that. And so we want to have that sort of bi-directionality. So we limit the number of interviews so that you can really get to know us and we can get to know you. So hopefully when everything goes into the sorting process, it all works out for the best.
Dr. Sue, how about you? How many interview slots does your program have, and has that changed with the virtual platform?
We interview between 14 to 16 per year in 2 afternoons, and that we did not increase because we have more than adequate numbers of awesome candidates based on those 14 to 16.
Okay. Somebody posted a question: how many of our letters should be from REI faculty? Is it important to have all of them from REI? Can one of them be from an REI faculty and other ones be from other faculty that have gotten to know you, perhaps done research with you? Dr. Grow?
I don't think it matters too much. You know, one REI faculty would be plenty, but people who know you and can speak to your dedication and love of medicine and love of taking care of women and your passion and your fire. I think that's what really matters.
Is it common to reach out to those that have written recommendations for applicants?
So it does happen, you know. So Dr. Penzias was saying, well, if you have two candidates who are pretty closely ranked, you know, when we're trying to make that final list, once in a while we will reach out to a colleague that we know and say, you know, what did you think about this person?
Yeah, thank you.
Can I just add a comment to that? Sometimes when you're thinking about who to write your letter, particularly at some programs that have a character that has loomed large in the field of REI, one of the common mistakes people make is that I must get a letter from this person. And if you haven't worked with that person, they don't know you well. This person's written a lot of letters, and the faculty have read a lot of these letters, and they can really read between the lines when they say good, great, exceptional, excellent. And sometimes they're putting top 10% of students I've trained, top 1% of students I've trained. So I think really prioritize finding someone who can write a strong letter, who knows you and can make it personal, rather than someone who is a popular name in the field who has written a lot of letters in the past, if they don't know you.
And if I may add, Pietro, you know, some of the folks who, you know, the big names that write lots and lots of letters, you know, they often have a boilerplate that they just put a name in to, and no, you know, no offense to anyone, but we, as you said, we know when the person knows you.
And can I just add to that as well? You know, I think that just on that same theme, if there is an REI division in the department that you're coming from, and you've worked with one REI, and maybe it's somebody who's on the junior side, but they know you really well, I'd rather get a good letter that is detailed from somebody who is in the field, who you've worked with closely, than that senior person who's going to just do a boilerplate. And literally, you know, as I start reading that letter, it's a recitation of your CV. You know, once I see a letter that starts out reciting your CV, to me, that nothing says I don't know this candidate well better than a recitation of the CV in the top of the letter.
Thank you.
And sometimes people do joint letters. Don't forget about that. If you've worked really closely with two people and they'd like to write a joint letter, they can both sign it. That's something that you see happen sometimes. People combine efforts.
And I think one way to consider who you get is, and particularly for our first and second year residents that are joining tonight, is that finding someone who will be a really great mentor, will hold your feet to the fire so that you finish that research project, but will also be your biggest cheerleader, your biggest sponsor. Those are the people that you want writing your letters. So finding that faculty or that community physician, whether they are exactly REI or not, I think that is one of the best things to be doing early in your residency. We don't expect you to knock out 5 publications by the end of intern year, but finding someone who's really going to help you push towards those professional goals, I think can be really important.
Thank you, Megan. A question was asked: is there a regional bias, East Coast, West Coast, when evaluating candidates? Dr. Sue is the only West Coast person here, and perhaps I'll direct that to you.
Only if you like having tacos on a beach.
Anybody has a problem?
Yeah, I think I saw an earlier question about how do you indicate geographic preference. And so sometimes we see there's an email from a candidate outside of the US saying, hey, there's a particular reason, I'm couples matching, whatever a circumstance, and your personal statement may also be a place that you consider sort of writing those circumstances. And if you have a good reason why our program is a fit, we would like to know that. And if I could add, I wanted to thank Dina for that comment about diversity. I think that this is something that our field, medicine in general has leaned toward, and all of us. So for example, at the University of California, there's a sort of a deep need to increase diversity, and that is a critical part of our evaluation of the application. To what I said earlier, what distance did you travel? What context got you here?
Okay, it looks like we're rounding the close of the hour. Any parting last words of advice for those that are applying? Dr. Penzis, we'll start with you.
Yeah, I think that what I want to hear in your application is really who you are. I can see, where you went to school, and I can see all of the metrics, but really tell me, what your interests are, what motivates you, what really jazzes you, and also what jazzes you about this field. Why REI? There are lots of things that you can do across a breadth of reproductive medicine in women's health, but why REI? Is there something that is really that fire inside of you? So I'd love to have that conveyed, and to me, whether you come from, a big program, a small program, makes less difference, but just tell me what your fire is and why you think that we might be a good fit for you.
Thank you. Dr. Groh?
I would echo that, and we want to get to know you. We're going to select how many? 45 REI fellows this year who are going to join the best practice in all of medicine. I think many of us really believe that and feel passionately about that. And we all want to see the field continue to be advanced. Show us who you are, and it'll, we'll appreciate that.
I agree with you, Dr. Groh. It's truly an honor and a privilege to be in what I think is the most prestigious field in medicine. Quite biased, though. Dr. Sue.
I would say thank you for thinking about coming into REI. We know that there's a dearth of REI specialists. Our field is growing. So I think you'll have a really successful long career coming into this field. And then I want to know where you're going, where you see yourself, 5 years, 10 years, something like that in your personal statement.
Thank you. And Dr. Hill?
I just want to congratulate all the people who are listening on considering the best field of medicine. REIs are an incredibly content and happy and motivated group of people. And we're a small enough group that we're all friends with each other. And so it's great to see everybody else on. And fertility and sterility in February, there's a survey of the SREI board certified physicians around the country, and they're incredibly satisfied and motivated. And the things that give them the most satisfaction are their patient interactions. We love taking care of the patients we take care of, and the intellectual curiosity. This is such a young field, and there's so much learning and so much research. So I just want to congratulate all of you on thinking about choosing this field. You will not regret it.
Thank you. Perhaps any last words of advice from the current fellows on those that are applying? Pietro.
I think the program director said it perfectly. I'll put in a plug. If you're ready to get started, but you're not a fellow yet, listen to the Fertility and Sterility podcast. It's a nice way to learn a little bit about what's coming up in our field, get you current without having to physically pick up a journal. And that way, when you're headed into the interview process, you can at least know what's coming out and what people are discussing. It adds some background knowledge, I think, that hopefully will make you a strong applicant. And I just can't wait to meet some of you on the interview trail next year.
Thank you. Megan?
So I'm going to reflect back to the past. 42 years ago, nobody thought we would be doing what we're doing every single day. And so who knows what in 42 years in the future, all of you will hopefully be helping us do. I think it's an incredibly exciting field, and bringing that enthusiasm for science, for our patients, and for, again, one of the best jobs out there, I think is what you need to bring to this process.
Thank you. And Quentin?
Sure. Just piggybacking on Pietro's comment, I agree. I'm a huge fan of the podcast. I definitely think it breeds a lot of excitement about really upcoming research and really the direction of our field. But my last parting words, thinking about everyone's comments tonight, I really think I can't overemphasize the importance of the personal statement and really just communicating this enthusiasm and expressing your long-term career interests. The best advice I received when I was in your shoes was it's never too early to start thinking about the personal statement. So every time I had an interesting or particularly emotional patient experience, I would jot a note on my phone so that when I actually sat down to write my personal statement, I had a wealth of ideas to choose from. And I really think just reflecting on my experience through fellowship recruitment as a third-year fellow, it's an integral part of the application, and it really gives you an opportunity to show us who you are.
That's a great idea. And we'll end with Dr. Wheeler.
I want to really thank, first of all the residents and for joining us today. It's really been exciting and such a great group. And our panelists have all been wonderful. And as you can see, we all know each other, at least peripherally. I feel like I've gotten to know so many people over the years, and it's really been great. I think that if there are a lot of resources that Sarah has listed in the chat, please take advantage of those. And if there are questions that didn't get answered, just let Sarah know. I've tried to sort of keep track of them on the side here. And if I didn't answer them or the panelists didn't answer them, just send a quick buzz to Sarah. And I think most of us are willing, if you reach out to us with a specific question, to answer that. And I really want to thank you again so much for joining us tonight, and especially Sarah for organizing all this. She's done an amazing job, and we're really lucky to have her as our ASRM leader for this process. So have a wonderful evening, and I'll turn it back over to Ronnie for his last few words.
I want to thank everyone again for joining as well. Like we said earlier, it's a very exciting but anxiety-producing process, and I hope that answering these questions perhaps alleviated some of the anxiety. And I think this is an amazing community of physicians to join. Again, you're in an elite group, a prestigious group, and it's truly a rewarding field and a rewarding career that lies ahead. So I'll echo what Dr. Wheeler said. If there's any other questions that weren't answered, please feel free to reach out, and we'll do our best to get those answered. And best of luck to all of the future candidates. This is the beginning of a long and very fruitful, productive, and rewarding road.
Thank you, everyone, for joining us. To our panelists, thank you for your time and words of wisdom. To our moderators, fantastic in moderating such a unique and interesting, engaging session. This webinar was recorded. Thank you for the attendees. Thank you for your time. I wish everyone best of luck in your process, and good night. This concludes our webinar.